Hi, Assalamualaikum. My name is Putri Idina binti Mugat Syamsul Anwar. Today I would like to talk about how Malaysia and United States of America tackle the Covid-19 disease. 2019 is a novel pneumonia disease originating in Wuhan. It was confirmed by the World Health Organization on January 12, 2020 before becoming an outbreak in all countries. Let's look at how Malaysia handled pandemic Covid-19. On April 14, 2020, Malaysia had reported two waves of Covid-19 cases, with the first wave ending successfully within less than 2 months. In early March 2020, the second wave occurred, with worrying situations. On March 11, Malaysia identified its largest Covid-19 cluster, which was linked to a mass religious gathering, better known as the Sri Petaling Tabligh cluster. This cluster had led to massive spikes in local cases and an exportation of cases to neighboring countries. In order to break the chain of Covid-19, the government of Malaysia enforced a movement control order starting on March 18, 2020. States critical measures has been set during the nationwide Movement Control Order MCO, which is to complete prohibition of movement and large gathering across the country. Step 2. Complete restriction on all overseas travel by Malaysians. Step 3. Complete restriction on all tourists and foreigners entering into the country. Step 4. Closures of kindergartens, nurseries, government and private schools. Step 5. Closure of all public-private higher education institutions as well as skills training institute. And the last steps, closure of all government and private premises except those involved in providing essential services, including health. Additional action has been taken to ease breaking the chain of Covid-19. First, a provisional hospital was set up and collaboration with healthcare service providers were granted, while additional laboratories were assigned to enhance capability of the Ministry of Health. Then, the Enhanced of Movement Control Order has been implemented. EMCO was an additional stricter measure that was a necessary step in controlling the spread of Covid-19. An initial financial stimulus amounting to RM20 billion was released in February 2020, before the highlighted Prihatin package amounting to RM250 billion was announced. The Prihatin package has provided governmental support to society, covering people of various backgrounds, from students and families to business owners. Now let's take a look on how USA tackled the Covid-19. Did the United States do enough to flatten the curve? Could they have done better? How does the United States compare to Malaysia in regard to Covid-19 responsiveness? The Covid-19 pandemic in the United States is part of the worldwide pandemic of coronavirus disease, caused by severe acute respiratory syndrome coronavirus 2. The first confirmed case of local transmission was recorded in January 2020, while the first known deaths were reported in February. By the end of March, cases had occurred on all 50 U.S. states, the District of Columbia, and all inhabited U.S. territories except American Samoa. The Trump administration initially responded by declaring a public health emergency on 31st January. On 2nd February, it began to prevent the entry of most foreign nationals who had recently traveled to China. The initial U.S. response to the pandemic was otherwise slow in terms of preparing the healthcare system, stopping all the travel or testing for the virus. Meanwhile, President Donald Trump downplayed the threat posed by the virus and claimed the outbreak was under control. On March 13, President Trump declared a national emergency and largely waited until mid-March to start purchasing large quantities of medical equipment. Furthermore, large and small companies have instituted work-from-home programs and local authorities have closed schools in favor of home-based teaching to mitigate the spread of the disease through social distancing. Next, the U.S. Department of Health and Human Services (HHS) and some private healthcare institutions embracing Twitter and Reddit to keep abreast of the new information and to reach out to the public. Hospital and healthcare departments are finally taking steps to mitigate the spread of the disease by creating clinical pathways to testing and treatment. According to the action that has been taken, Malaysia has been recognized as one of the most successful countries in handling pandemic COVID-19. Despite being forced to remain in isolation, the pandemic has brought Malaysians closer together, from government and frontliners to activists and the public, in the war against the COVID-19 virus. Meanwhile, America still has a hard road ahead. America has passed a key milestone: 100,000 deaths from a novel coronavirus that began to spread half a year and a half war away. Americans think that their president has handled the epidemic disastrously, that their country has been hit uniquely hard, and that there is a simple causal relationship between the two. That's all for me. Thank you for watching.